Dr. Shimmian Aesthetic Center is the only center that offers a comprehensive approach in rhinoplasty. I'm Dr. Levi John Lansangan, and I'm the Medical Director of Dr. Shimmian Aesthetic Center. And Dr. Shimmian Aesthetic Center is proud to offer a very comprehensive form of rhinoplasty wherein the whole armamentarium of materials to be used for augmentation or reduction rhinoplasty can be offered to the patients. Right now, we have the minimally invasive form of rhinoplasty. This includes the use of threads and fillers, and they come as a PCL or a PDO thread. And these will be inserted with a small puncture into the middle of the nose, and then 5 or to 10 pieces of these threads can be inserted into the nose bridge. Lalagay dito sa nose bridge, and then we could add fillers to add matrix and volume to the nasal bridge. The problem for the non-surgical nose lift is that the other components like the nasal tip cannot be addressed, as well as the wideness of the alar base cannot be addressed. So you need other form of procedures such as alarplasty and nasal tip surgery to complete the 3 parts of your rhinoplasty. When your research becomes more advanced and you know that this non-surgical form of nose lift doesn't last forever, and the most that it could last would be around 2 to 3 years, you go to the invasive form of rhinoplasty, which are the surgical rhinoplasties. Okay, for the surgical rhinoplasties, we have 2 forms: the use of the elastic and porous implants, and the use of the autologous and homografts implants. Okay, so the elastic implants would be the use of silicone implant. Okay, so these are the silicone implants. They come in flesh or white forms, and they could be I-type or the L-type of an implant, and they could be inserted with a small incision on the side of the nostril, and this implant could give nasal bridge augmentation, give height to the nasal bridge, as well as definition to the nasal tip. And then you could add alar base to complete your 3-point rhinoplasty. The other form would be the porous form of the implant, which is the Gore-Tex, which I introduced in 2003. Gore-Tex naman has the advantage of being porous, so your tissues grows into and around the implant. So it's very natural looking. The problem with these 2 implants are they are still foreign body. And foreign body means chances of infection is still there. Okay? So nowadays, there are new implants which are the irradiated rib. The thicker form can be used for nasal bridge augmentation, and this straighter form or the flat form can be used for nasal tip surgery. So the advantage for the homografts is that it's a worry-free, natural-looking, and a complication-free nose lift. Nowadays, I advocate the use of irradiated rib for rhinoplasty. Sometimes other patients request for their own rib. Okay, so we remember that the own rib, your own rib, can give you that adequate height for the nasal bridge augmentation and nasal tip definition. Okay, so hindi kaya yan ng septal cartilage or your ear cartilage. Okay, but the problem is patients don't always like a secondary chest scar or an injury to its chest area to remove part of its rib. That's why the irradiated rib is a win-win solution, because it decreases the morbidity for the patient as well as it decreases the surgical time for the surgeon. It's what we call as a simple, safe, effective, and still economical, because you don't have to be in general anesthesia in order to undergo irradiated rib rhinoplasty. That is the whole armamentarium right now for the rhinoplasty procedure. So just remember that Dr. Shimmian Aesthetic Center is the only center that offers a comprehensive approach in rhinoplasty. So we take a pre-op picture and advise the patient all the techniques that have to be performed in order to achieve its aesthetic desire. Okay, so kung kailangan we have to perform an osteotomy breaking the bone, or just a simple cartilage augmentation, or we need these implants. We all discuss that to the patient. Okay, so we let them understand. So as we all say, we transform lives and we make things happen. So only at Dr. Shimmian Aesthetic Center.